Good morning, everyone. I'm Jill Jensen Chadwick, and I'm coming to you from the Dolph C. Simon studio. And as you can tell, Dr. Steven Stites is not here this morning. He had urgent medical business to attend to, and we know that he's got two day jobs, this one and yes, the other one. That's right. But Dr. Hawkinson is with us here. He is the medical director of infection prevention and control, a very familiar face. Let's get right to the numbers.
Yeah,
how are we doing today?
We are still good. This past week we've been good. You know, the numbers have been down from where they were. We were hoping we wouldn't get up into the high 30s and 40s and stay there, and we certainly had 39 at one point. But now we are in the mid 20s, so 26 in the hospital currently. We have 9 in the ICU and 5 of those on the ventilator. And then the numbers of the patients that we have had here in the past who have we considered to be able to come out of isolation because they've been here so long after their original diagnosis, that's 21 or 23 patients. So we still have some long hospitalizations, but those people are, getting better and hopefully be able to be discharged soon.
Part of what we're going to talk about today is the long part.
Mm-hmm.
This pandemic is taking a toll on everyone, on patients and physicians and the community. And we are hearing from a lot of you about feeling anxious and even depressed, and it turns out it's really with good reason. Listen to this. A survey taken by the National Center for Health Statistics shows that nearly 30% of us are experiencing symptoms of clinical depression, and that compares to 6% at the same time last year. The numbers are similar for feelings of anxiety. 36% surveyed are feeling more anxious about life now compared to 8% last year. Online mental health screenings have increased 400%, and CDC Director Robert Redfield recently stated that more young people have died of suicide and drug overdoses than of COVID-19. It's very sobering news that we're going to talk about with our experts today. I want to introduce to you Archbishop Joseph Naumann of the Archdiocese of Kansas City in Kansas. He's joining us by Skype, along with Bishop Susan Candea of the Central States Synod of the Evangelical Lutheran Church in America. I want to say welcome to our guests this morning.
Thank you.
I want to start with the Archbishop. Tell us what you're hearing and seeing and what you're saying to your parishioners about COVID-19.
Well, I think what you mentioned at the beginning, I think many people are deeply affected by this. And, I think the isolation is weighing on everybody, but especially our elderly people. This is one of the great concerns that I see at a time in life when they're least able to cope, I think, with isolation. They're being isolated. So we're keeping them physically well, but I think we really need to look at, and I have a 97-year-old mother that's in a skilled nursing center right now. So I think we need to attend to the whole person, not just the physical, which obviously that's very, very important. We're also very concerned at this moment with our schools and with the opening of the schools and how we can do that well, but I think especially our young people, I think, are really they're at least at risk in terms of the disease, but they're very much at risk in terms of some of these other factors that play on their mental and emotional health. But my message to our people is: be not afraid. The Lord is with us, and that we can take solace in this. It's a time when I think as Christians we're called to be instruments of hope to others, and that we have a responsibility to work for the common good. So we have to try to cooperate with our public health officials and do all that we can to keep not only ourselves safe, but others in the community safe as well.
Thank you very much for that, Archbishop. And I do want to talk to you a little bit more about your message to even the general public, believers and non-believers alike. But first, I want to go to Bishop Susan Candea. Same question. What are you seeing? What are you hearing? And what are you inspiring people that you serve?
Thank you. Certainly the stress on everyone is tremendous. This virus has woven its way into every aspect of our life together as community. And oftentimes when we have a crisis, as we are in now, what we do as people of faith is we gather. We gather together with rituals to comfort one another, to hear the good news, to share in, for us as Christians, the sacraments. And we're not able to do that in the same way because we need to be mindful of how do we keep one another safe. And so we're having to explore different avenues and different ways of connecting with a reality that is stronger and bigger and more pervasive than even this virus. And that is the reality of God. Some people talk about a higher power, a spirituality, but there is more. And so during this time, I think it is forcing us, as never before, to really connect to our own spirituality and the connection going deep within ourselves to connect with our value. And so that is what I'm encouraging people to do. While this feels so incredibly challenging, there are incredible opportunities for us to grab on to our faith in ways that we've never had to before, while we're also connecting deeper within ourselves and our own spirituality. I think faith helps us connect with one another and to recognize we're not in this alone. And while we cannot physically be with people, we are all connected as one humanity. And so how do we continue to live that connection in ways that are faithful and safe? And so I think that's a message of hope.
Thank you. I read somewhere that this pandemic is different than other crises that we've gone through before, because with a tornado or with a flood, many times the sun comes out, the waters recede, and we're able to lean on one another physically and shore each other up. But with this pandemic, we can't do it. And it's going on, and it's causing anger now, along with the fear. What words of encouragement might you have to help people understand maybe new habits or new ways of thinking for the long term? I'm sure that you get a lot of people that come in and say, I'm just tired of this. I don't know if I can keep doing this. I'll start with Bishop Candea.
Well, I certainly echo that. In fact, I was just talking to a friend last night, a good friend, and I just said, I'm cranky. I am so tired of this because every decision I make now has this extra layer. So what I have found, I have been a church-going person my entire life. I've been in ministry for 37 years, and every Sunday I have gone to church, and that has helped ground me for the next week and the next week. So now what I found myself doing, there are many services online, but I go out in nature and I walk, and God and I have very loud conversations at times. And it is okay to lament. Scriptures are full of laments. And so I yell, I cry, I let God know how angry I am. And there is something about releasing that and knowing that that is heard that enables me to take a breath and say, okay, I will go another week and another week and another week. And that's what helps me.
I like that part about finding something that helps ground you. What grounds you?
Just being able to get outside, walking, running, all that stuff,
Archbishop?
Looking at the sun.
Yeah, looking at the sun. I love that. Archbishop?
Yeah, I think we have to encourage our people to look for the positive. And we, as Christians, we look at everything through the prism of the cross and the resurrection. And we believe that the Lord even draws out of adversity good things. So one of the positives I think that many people have experienced is a time with family that been kind of forced to adjust their schedules. And I think many have found that as really a beautiful thing, that they've been able to spend time with family and have conversations that with their usual schedule just wouldn't happen, have meals together. So I think there are some positive things that are happening. I think also, Dr. Hawkinson was very helpful to us to try to, how can we have church again, but do that safely? And like Bishop Candea said, we're a sacramental church, so everything we do involves a physical contact in some way. So how can we still do church, but do that safely? And I think, that I think has been a great consolation for many people. It has been for me to be able to celebrate the liturgy. I think personally, I've found ways to connect with people that I probably would have never done. For a long time, I was celebrating an online mass daily from my chapel in my residence. And now I do daily meditations, and I was reaching about 1,200 people a day. So there are, I think we have to look at some of the positive elements to this that the Lord is drawing forth from it, even in the midst of all of the aggravation, all of the inconvenience.
Tell us a little bit about your schools resuming. I don't know if some of them are back in session, perhaps. Some of the private schools are close to it. What are you hearing from parents? What have you done to prepare? How did you coach them?
Well, I'm just really appreciative of the opportunity to get to work with Archbishop and the diocese to get out the message to anyone, but especially the parishioners, anyone who may come into the church to celebrate and be with the Lord, but to keep those people safe, keep their families safe, because we know this virus spreads. It's very easy. You may not even know you have it. And it's not just you that are affected, but it's people in your bubble as well. So really getting out the message of how to keep everybody affiliated with whichever parish they may be going to safe, and doing those optimal practices during those times. And I think it's been well received. And so that's been a real good piece for me, and real appreciative to do it. But otherwise, we want to keep getting that message out there to everybody on things to do to reduce the risk of the spread of the disease.
Archbishop, are you guys ready for school? Do you feel good about it?
Yes, well, we take in 21 counties, so it's very different, for instance, up in Seneca, Kansas, than it is in Johnson County. And so some of our schools have opened in different parts, but the Johnson County ones have not. But they're prepared to do that on the 31st, observing social distancing, masking, all of those things that that the medical professionals tell us are really critical. We're prepared. We want to do in person, and we think that that's really important for our young people, but we want to do it safely. We want to accommodate through distance learning those for a variety of reasons may not feel safe to come in person. So I think most of our schools will have a hybrid of sorts. And then if we have to pull back at some point, we're prepared to do that again. I'm just so grateful to our Catholic educators. They've done an amazing job of pivoting last spring and taking up the challenge of instructing the kids through distance learning, imperfect as it is, but a lot of beautiful things happened.
Enrollment up or down?
Well, that varies from school to school. I mean, some of our families are going to homeschooling because they fear that we're not going to be able to sustain the in-person this year. So some of our parishes I know have seen significant drops. I was at a parish last night with a confirmation that we did, and their numbers are actually up. And it varies from school to school, I would say, on that. But it's really presenting some serious problems or challenges for us, because our people have to sacrifice heroically financially to send their young people to school. And if they're not getting the in-person, that poses a lot of questions for them if this is if they can afford to make that financial sacrifice. And we also have people that have been financially affected by this, so we're trying to provide as much help and support we don't want to lose any child because of financial reasons.
Bishop Candea?
We actually, the Lutheran ELCA does not have a strong tradition of having schools. So we only have one congregation actually in St. Louis that has a school. So we're more focused on worship and providing opportunities for people in that arena. And right now there's a variety of decisions that are being made. We too strongly recommend that in-person worship entail mass and social distancing, no congregational singing. The whole issue of communion is extremely challenging, but many of our congregations have chosen to remain online. Another option has been to have outdoor worship. So it really has been a challenge to continue worshiping while at the same time doing things safely out of love and care for our neighbors.
Thank you. I think we're going to go to community questions now. My understanding is we don't have media today on the line. So, Jess, what is the community asking?
So this is specifically for Archbishop Naumann. This person says, I attend Mass, but I am afraid to receive Holy Communion because the prayers are so close to the altar with no masks.
Well, what we do for Holy Communion, the Blessed Sacrament is covered the entire time during the prayers at the altar. So while the celebrant isn't wearing a mask at that time, we've taken precautions, and we also I think in most churches they're moving them out of the direct line of the priest that would be speaking. So, and we've had really no episodes that I'm aware of any kind of contagion through the liturgy. So I'm really proud at how seriously all of our people have taken these precautions. And again, in giving communion, we do that with no hand contact at all. And if we do, then the celebrant will purify his hands before he gives communion to the next person.
Dr. Hawkinson, weigh in on that.
Yeah, and from what I understand, and those were specifically in our recommendations as well. So everything I know about generally for the Catholic services, if there is not a mask being worn by the priest, it's because the distance is great. It is much greater than 8 feet or 10 feet to the parishioners. And I know in talking with my boss, Dr. Hinthorn, who frequently attends a separate non-denominational church as well, their priests or fathers or who's celebrating Mass and church with them, they don't wear masks either because they are separated by a distance of more than 8, 10, even 12 feet. So that poses a very little risk. And so again, it's the distance. There isn't really singing as well. And so I think that is otherwise safe if you're not wearing a mask in that instance. If there is contact or closer proximity to anybody else within the church, obviously masks are being worn during that time.
I know that yesterday we got a lot of questions from, or not a lot, but 2 or 3 that were concerned about band, blowing instruments and playing instruments. What is your advice on that?
Yeah, that's pretty good. There is a very little amount of research on that. We know that some singing and windwood instruments and wind instruments can disperse the air up to, half a meter to 2 meters in front of them. We know that some of the instruments can produce smaller particle sizes as well. We are still looking into that. There is still research being done. But it's still looking like, for the most part, a lot of issues with the bands can be, 6 feet or 2 meters or more apart. But then you also have to just think about how many people are gathering to do that. So there are a lot of intricacies there. Right now, it's still probably a dangerous prospect, but more and more information is coming out specifically about that subgroup or that subpopulation, singers and instruments as well.
Michaela wants to know why the diocese is not following the health department recommendations of just going remote.
Well,
Archbishop.
Yeah.
Are they talking about schools in this?
She didn't mention specifically.
I would assume it's the schools.
Okay.
And again, I mean, we are trying to follow as closely as we can what the health professionals are saying. And we think the social distancing and the mask really do provide us, there's no risk-free environment. So everybody has to be aware of that. But there are risks at keeping the students at home. There are risks at doing this education remotely as well. And so I think we have to balance what those risks are. And again, we try to accommodate what the parents, what they feel is really best for their child. And of course, another big concern is keeping our teachers safe as well. And again, we think we're taking all the prudent precautions for that.
Yeah, and I also have to look into this. I'm only familiar with the Johnson County gating criteria, but I think that the diocese schools were using other Kansas State gating criteria as well, so I think that's a component. I'm not as familiar with the full Kansas State gating criteria as I am with the Johnson County gating criteria, so I think that's an aspect as well.
Bishop Candea, I bet you have parents coming to you all the time and saying, I don't know what to do. Do I send my student to class? Do I keep them home? How do you counsel them?
It really is. I have grown sons. I do have a granddaughter who is supposed to start kindergarten this year. Well, she is starting kindergarten, what that will look like. There is tremendous stress on parents. And I think the first thing is simply to acknowledge that this is unprecedented and these are difficult decisions. And we need to not be, different parents will make different decisions. And I try to encourage them, listen to your own instincts. And as Archbishop said, there's no risk-free environment. I mean, there are risks all the time. It is balancing it. But we need to not, for lack of better words, attack people that make different decisions. I truly believe that parents are acting in the best interests of their children, and they're going to be making different decisions. And so let's give some grace and some patience and some space for people to make the decisions that are right for them. So that's what I try and encourage, rather than saying you should do this or you should do that. Let's give each other some grace in these days.
Archbishop, I'm sure you have a lot of parents that say, I want my kids to be back in school, but I'm afraid. What do you tell them?
Well, I tell them they have to make the decision they think is best for their children. And so if they feel that way, again, we're going to try to do everything we can accommodate with the option of some distance learning, but also to make it available. We've also have a tremendous amount of pressure from parents saying, we want our children in school. We want it done safely, but we want them in school. And there's a lot of data out. I mean, it's confusing, I think, for the layperson, because there's a lot of data out there that say children are the least at risk, and that they don't really transmit the disease as much as the flu and other things. So there's a lot of conflicting data. I can almost tell what cable station people are watching by what questions they bring to me, because the way that it's being presented from different sources of media really gives people a totally different perspective.
Is there any way that you can help reconcile some of that? I mean, you're the infectious disease doctor in terms of, and we're getting these questions a lot lately too about, the county stats say one, the KDHE stats say another, and they're trying to use all of this statistical data. Help us reconcile some of what's happening, and what can parents do at home if they opt to send their kid to school to make sure that kid's ready to go?
Yeah, so those are a lot of questions there.
I know. Unpack it.
So it is difficult to assimilate, number one, all of the information about the virus. Because the message changes, and the message changes based on the available data. And some of the first data coming out was that children don't spread it as much. Well, was that because you really weren't looking for it in the child population because they weren't getting as sick and going to the hospital? Was it because the school shutdowns, so they weren't able to interact much? That had a component. That also saved a lot of lives. But as we get to have more and more information, we're learning more about, and we're getting better information from our experience here in the United States, which is different than any other experience, than the experience in Japan and Korea and China and Italy and in New Zealand. So we're getting better information about that. We're understanding more about the attack rates in the household, whether it's from a child to an adult or adult to child. We're learning that children have the same viral load, or seem to have the same viral load in their upper respiratory tract as do adults. But for one reason or another, why do they not seem to spread it as much? Is it more asymptomatic than adults, which are thought to be maybe now 30 to 40%? It's very difficult. So the message is changing. We would ask everybody to be vigilant, but it's changing based on the available data, the best available data. So we are trying to keep up and do that. Now, do you want your children to go to school when you try to assimilate all this information, whether it's positive rates or number of positive cases from any one community or any one county? Certainly in Kansas City it's more difficult because we look at the whole Kansas City area. But we also have specific gating criteria for things like Wyandotte County and Johnson County, and those are different as well. So it is difficult to assimilate all of that information and which message is true. I would just say continue to look at the CDC website, continue to look at the KDHE website, as well as the Johnson County or the Wyandotte County or whatever county you may be in. Those websites for the most accurate, up-to-date information. Do I want my children to go to in-person learning? I absolutely do. I feel it's very important for psychosocial development and their health, but it has to be in a safe manner, and it has to be in that community. Is it safe? Because we know, and we've seen other reports from schools that have already opened that have had to close or had clusters. I have a friend of mine who is at a high school who teachers went back a week before. They tend to go back a week before. Well, now there's at least 3 teachers with COVID-19 positive tests. I have a best friend in another high school, and the dynamics there are not conducive to a safe environment. Nobody's wearing masks. There are all school meetings. There are small groups that are meeting that are close together. So I think we really have to get down, unfortunately, into the dynamics of that community, of that district, of that school. What is the infection spread? What are the dynamics within that community? And then for that specific school or that school district, what are the engineering things that are taking place? What do the size of the classrooms look like? Are people going to be vigilant? Are the administrators going to be vigilant and have mandatory masking and separation and not meetings where people are meeting, including the students? Because it's not only the students' health, it's where those students are going back home to take the virus. But it's also the administrators, the teachers, the counselors, the custodial workers who are essential for keeping everything clean. And so there's all those intricacies that you have to think about it, and one plan is not necessarily good for all of the counties, for all of the districts and all of the schools, and it really comes down to those administrators in that school and in that school district to make that decision based on maybe gating criteria that's put forth by the state or the local health department.
You have said in the past that your children are going to go to school. How do you coach them? I know you're keeping an eye on all this other stuff too,
Yeah.
and you have the right to change your mind at any point.
Yeah.
But in the meantime, how are you getting your kids ready?
I think that and hopefully, a lot of healthcare workers, not just myself or physicians, but nurses, therapists, people who are working in the healthcare system, but anybody who has been vigilant in watching, I don't want to say appropriate, but the correct news and the correct guidance, and that is from the CDC and Dr. Fauci, and the obviously Secretary Norman and Governor Kelly have been good as well. Watching those types of reports and learning and understanding what to do. And then it becomes second nature, teaching your children early on and from home about masking and about staying distanced. It's difficult with younger ages, absolutely, but I coach my son all the time, okay, if you have to be in this situation, just ease back a little bit and keep that distance. Wearing masks is very good in their community and what he's doing with some extracurricular activities, and so that's important as well. And I think now that we are this far into it, hopefully people have been teaching their children and have been doing it themselves, and so then it does become second nature. We have seen pictures that people sent us of their children, of young children even wearing masks and being okay with that. And so I think it's just a matter of a culture change. And children, we hear this all the time, children are resilient, but they do take cues from us, and they are able to learn fairly quickly and be able to do that. And I know they probably will be manipulating it more than they should be, but again, any mask barrier is going to be more important than none at all.
Wash your little hands after.
Wash the hands, do the hand sanitizer, absolutely.
Yeah. Question?
So, Joe, we're getting some questions about stress and anxiety, so I think our panel could really help us out with some of these today. And I've got two questions that came in from two different viewers. So, Neil says, any tips for anxiety? He says he comes home from work, he feels drained and wants to do absolutely nothing. So I think we can all relate to that. And then Donna says, are there other ways, other than going back to work and school and church in person, that we can still be creative and try to connect with others?
All right. I'm going to go to Archbishop first. Weigh in. How do I keep from being anxious or deal with it, cope with it?
Yeah.
Well, I think if you're if a person of faith, I would encourage you to turn to the Lord. And if you're a Christian or Jewish, to turn to the scriptures and to read from the Word of God. Bishop Candea said before, I think our prayer needs to be authentic. It needs to be real with God. So he knows what's in our hearts. So we have to express that really. But then, an important part of prayer is listening to the Lord. And I think if we do that, we know that the Lord is with us. And the phrase that's most often used in the scripture is be not afraid. And so I would encourage him just to, if he is a person of faith, to open his heart to the Lord, be honest, but also hear the response to that. The Lord is with us and he's there. I also, I think physical exercise is a good way, even though you feel like doing nothing. For me anyway, a lot of times physically exercising is a good way to release some of that tension and prepare myself physically, I guess, for prayer. I would say also don't watch a lot of news. I think you can overload on information on this. We need to get good information, but I think just watching television is probably not going to help you a whole lot.
Before I go to Bishop Candea, the Archbishop mentioned fear, and I've heard doctors speak that fear is actually not good for my body either.
Yeah.
How does fear affect me physically?
Any anxiety, fear, there is some good stress and anxiety, but we're talking about the harmful stress and anxiety. On a biochemical level, that can certainly have changes in different chemicals in your brain that can lead to immune dysfunction, just different chemicals and inflammatory process in your body on the chemical level. And so overall, physically and mentally, it's just not a healthy thing.
Bishop Candea, how do I not be afraid and feel anxious? How do I deal with that? And I got to tell you, I relate to this man. They wrote that question.
Absolutely. Well, first of all, we acknowledge that we are fearful and we are anxious, and with good reason. Again, for me, what really helps is, beyond that honesty, is again, as we've heard, walking. I tell the story. I have walked every block in every configuration of my neighborhood through these months of pandemic. And there really is something incredibly healing about nature. Isn't it amazing how God has given us this way to be healed by creation that continues? even in the midst of our anxiety. Also, things that I found helpful is journaling. Instead of stuffing that anxiety or fear, write about it, put it out on paper. Again, be honest about it. And also, one more thing, music. While we may not be able to sing in our congregations the same way, there's so much wonderful music. And I'll put a plug in for my Roman Catholic siblings. At the beginning of this, there's this wonderful, you can Google it on YouTube, Be Not Afraid. Roman Catholic musicians and singers came together. And when I'm really struggling, I find that song and I just let it sweep over me. And again, it reminds me that this fear is not the ultimate reality. And it brings me out to a better place.
Those are great advice from both of you. Do we have time for another question or two?
We do. I think this is for Dr. Hawkinson. What does brain fog look like, and how do we diagnose that other than patients that might just be losing their focus?
Yeah, I think, certainly Dr. Garanseth or Dr. Rippey, who we've had on, could answer that question more completely. But brain fog can be any number of different things, whether it is loss of focus or not really remembering, or it's just this tiredness and fatigue. And again, COVID-19 is not the only cause of that, but in this context, what we're talking about are certainly those aspects. And this can affect your emotional as well as just your ability to focus every day on things and just not feel right. Maybe it's just an overall malaise. Maybe it's just feeling different right now than, say, when the Chiefs won the Super Bowl before COVID-19. This can happen. We do hear this a lot in people who have been affected and infected by COVID-19. Hopefully that will resolve and recover, but it can take time, just as the other physical aspects may take time, such as shortness of breath or cough. Hopefully in time it will resolve and improve, but doing those other things for your health can help with that, and that is just to the Archbishop what he was talking about with physical activity, and to Bishop Candea's words of, it's other things that you can maybe find joy in, whether that's music or art or something like that, to really start to break out of that. And it may take time. Don't get upset or disgruntled. But as we move through this, hopefully it will resolve.
I got to squeeze a school question in. Okay. It wouldn't be a day without a school question. And
Correct.
Actually, two have come in very similar to this about kids being in a classroom, wearing masks, but being 2 to 3 feet apart. Yeah. People very concerned about the ability to social distance. Realistically, with masks on, 2 to 3 feet apart, is that safe?
Yeah, absolutely. We've talked about this. Some of the engineering in the schools are not the same as other engineering in the schools, with the distance and the ability to have a larger classroom. Certainly, again, we go back to the World Health Organization, which says 1 meter, approximately 3 feet. Because they have to answer to a larger audience of the world who may not be able to separate. I think the American Academy of Pediatrics says 3 feet is okay as well. Anything you can do to minimize the risk is going to be better. So that is absolutely masking for everybody and distancing as much as possible. Some schools have the ability and have the resources to have the plastic or the clear shields up on all the desks or between the desks. That's reasonable as well. Unfortunately, it goes back to every school. What are you able to do? 3 feet is definitely better than 2 feet. 6 feet is definitely better than 3 feet. I think you have to take that into account. Talk with your administrators. If you have to, discuss it with the county health departments as well. More is better. Masking is definitely better. But we do know, and this is a short amount of time, we do know that the hairdressers down in Springfield, where there were 2 hairdressers and they had COVID-19, out of 140 clients where both parties were wearing the mask, there wasn't spread of the disease that was apparent. And again, this is a published report by the CDC. But again, they're spending 20 to 30 minutes with clients, not hours at a time, for 5 or 6 hours a day. So that is the difference there. But anything you can do to reduce or mitigate that risk is going to be helpful.
I want to let everybody know that Sunny Says is going to make an appearance tomorrow, and she went into a school and rode a bus, and so we're going to have some great visuals to kind of give parents a feel for what it might look like going back to school for a lot of kids. So, final question?
Yeah, so Joanne heard Dr. Hawkinson say that he is sending his kids back to school. So you don't necessarily have to tell us their ages, but
Yeah.
she was worried about her 5-year-old. And so
Yeah.
maybe you can help us understand the difference between like a 5-year-old versus maybe a 10 or 12-year-old, and then maybe 18-year-old seniors in high school as far as the risk goes.
Yeah. Yeah, I mean, again, getting students back to school, if it's safe and the gating criteria is met, again, because we want to see an overall decrease of the rate of spread of the infection. So 5-year-olds, so my children are a little bit older, more like middle school age. 5-year-olds, they can wear masks as well. That is endorsed by the American Academy of Pediatrics. Is it going to be optimal practice? Will they be manipulating it? Probably, but I think they still can go back. If it's safe in your community, if it's safe in that district and within that school, and those other criteria can be met about spacing and about masking for all of the children and the teachers and everybody in that school. So with all of those individual details, I think it can be safe. And if you can teach them while at home, obviously we know the social distancing for somebody of that age is going to be difficult, but the masking is going to be important. Again, if it's conducible to going back to school within that community based on the gating criteria of that county or of the Kansas Department of Health and Environment.
This has been a really good discussion today, and I want the people that are listening to know we're going to be continuing it in the days to come. We are going to invite more clergy. We are going to invite more mental health experts who are going to give us specific advice that we can follow to help us get through this pandemic. We're even going to be talking to a dietitian who's going to tell us what to eat to de-stress, sleep better, and get through the pandemic. I'm going to come back to both of our guests in just a moment to ask for your final thoughts on us keeping our resilience and shoring us up. But first, I want to show you a couple of things. We are going to tomorrow talk about our questions that did not get answered. We're going to include some that are coming in today as well. So many great questions, so tune in and come with more. I also want to show you Nancy. She donated blood, and I so love the mask. I am a cat lover, too. I just keep wanting to know, where do you get that?
Meow.
And Diane says they took their bubble on a socially distanced vacation to Minnesota. It is a job well done. As Dr. Stites mentioned, we're planning to do something super fun right before Labor Day with both our doctors. You're going to want to see this. But we need your help. We need you to keep sending us pictures of your wearing masks and social distancing to keep one another safe. You can drop them to our Facebook or email us at medicalnewsnetwork@kumc.edu. And before we go, let's get our final thoughts, and I will start with Bishop Candea.
Thank you. For me, even as difficult and challenging as this time is, it is an opportunity to learn to love deeper our neighbors, ourselves, to connect with God, our spirituality. So I really see that as challenging as this time is, it is an opportunity for us to claim hope in ways that are real and authentic and can really make a difference in changing the way we understand our life together as community and on this planet. So that is the hope that keeps me going, that there is something more at work, and I want to be part of that as we come through this. Thank you.
Thank you. Archbishop?
Yes, I just want to say thanks to the University of Kansas Medical Center for doing this, and for all of our medical professionals. We're so grateful to them for all that they've done to try to keep us safe. I, too, would just say one of the ways I think that we can come through this best is not to be so inward focused, and when you're feeling down, to call somebody else to get support from them, but also to give support and encouragement. I think there are a lot of ways that the Lord is inviting us to show our love and our concern for others within the community at this time, and to be witnesses of hope.
Great advice from both of you. You both have inspired me too. I'm going to invite our audience to send us, whenever you send pictures, also send us what you're doing to try to enjoy life and to cope and to help your family and friends get through it. Thank you again to our guests. Final words from you, Dr. Hawkinson?
Yeah, I want to thank Bishop Candea. You know, we have some Lutherans in our family. I love them just the same. They're great people. And Archbishop, again, I appreciate being able to be part of that and really trying to get out the message to our parishioners, who we know a lot of our parishioners are also of that vulnerable population. But this message is going out to everybody about trying to be safe and mitigate the risk as much as possible. And we need to have our number of new cases every day decline on that 14-day or 7-day rolling average so we can get our kids back to school safely. And so the people within that school, the adults within that school can be safe, and the households that everybody goes back to is going to be safe. And the way to do it is going to be to continue to mask, continue to social and physically distance, and I know a lot of people are doing the right things, and also not meet in large groups. And by doing that, we can start to see a better decrease in the amount of new cases so that we can get kids back to school in a safe manner.
All right. Thank you.
All right.
And thank you. As Dr. Hawkinson has said, we all grow a little weary sometimes too. I think Dr. Stites, with his new phrase of cows, about having COVID weariness syndrome. And I just want to tell you how much your comments, your questions, your feedback, it really helps these guys too. So keep watching, keep joining us, and we will see you tomorrow.